Hello, I'm William Dunnet. I've been a consultant orthopaedic surgeon in East Kent since 1998. I'm a full-time NHS surgeon, but I also manage to fit in 1 day a week working privately. The ACL, or the anterior cruciate ligament, is the most important ligament in the knee. It controls pivoting stability and prevents you from getting secondary damage to the cartilages and other structures in the knee. So if we look here at the knee, you can see a knee normally flexes like that, and that's what most people think is all the knee does. Oh no. The knee has to glide forwards and backwards, it has to glide side to side, and most importantly for the ACL, it has to pivot like that. And these are the movements that all the ligaments in the knee are trying to prevent happening to an excess, but particularly it's the pivoting rotational movement that the ACL stops. And if we now look inside the knee, you can see that little orange structure in there in the middle is the anterior cruciate ligament. Well, the way you prevent injuring it is ensuring you don't twist in an uncontrolled fashion on the knee. For instance, you could be walking along the beach and you catch your foot in a pothole or a little sort of between pebbles or rocks and you twist your body, it'll rupture. If you're walking in the Pennines, for instance, and you catch your foot in a rabbit hole and twist, it'll rupture. If you're a footballer or a rugby player and you suddenly change direction and another player might thwack you on the side of the knee, you'll often rupture the ligament. So how can you prevent this happening? Well, you can't stop sportsmen playing things, you can't stop people enjoying the country and walking. However, what you can do is make sure people try to maintain a reasonable level of fitness and develop a skill. And this skill is to have good proprioception of the knee. Now that's a long, highfalutin word, but all it means is a knowledge of the knee in time and place. And there was a lovely experiment that a senior colleague of mine did when I was training. This is about 20, 25 years ago. And he wanted to see which patients did well after an ACL rupture and who didn't need reconstruction. And one of the simple tests he did, he blindfolded the patients and he would bend their good knee and bend their bad knee. And he would ask them to tell him how many degrees he'd bent it by. And they were blindfolded, so the only feedback they'd get is from the nerves that were attached in and around the ligaments of the knee. And if you had good proprioception, the patient was able to say, yeah, that's 50 degrees, that's 90 degrees, that's 80. Similarly on the good knee and on the bad knee. And so they had good proprioception. The ones that did badly and who couldn't rehab and needed reconstructions because their muscles weren't strong enough to stabilize the knee once the anterior cruciate ligament had ruptured, couldn't tell the angle at which the knee was put. So good physiotherapy, good training will help you develop proprioception. So that is how you prevent injury. And how do you injure it in the first place? Well, we've already discussed that. You have a twisting injury and it pops and goes. There's a very distinct clinical history to a diagnosis of an ACL disruption, and something that is absolutely incredible, and people don't believe it unless they see it happen. You could be playing rugby, football, whatever on the pitch, and if somebody ruptures their ACL, all the players on the pitch could well hear a pop or a snap as though a bit of wood's been broken. It's such a colossal injury, and that's one of the first things that you'll notice is a pop or a snap. The second thing you'll notice, unfortunately, it's quite painful. But the third thing is that helps us clinicians diagnose it quite effectively is you will get very rapid swelling of the knee. Within the first 10 minutes or so, it will swell up to a very tight knee joint. And that's because you get something called a hemarthrosis. That means blood in the joint. And there's quite a lot of blood vessels in and around the structures that are ruptured when the ACL goes, and they bleed fairly rapidly for the first few minutes. A lot of people get quite anxious about how their ACL rupture should be treated. They will hear of major Elite athletes will have their reconstruction done within 24 hours of the injury, and they seem to regard that as being the gold standard. So people think, my goodness, they've delayed the diagnosis by 2 weeks, I've missed out on 2 weeks of important recovery, and now they're telling me I'm not going to have my operation, particularly on the NHS, for 5, 6, 7 months. Actually, the timing doesn't matter too much. You have to have some insight into ACL disruptions. If you are an elite athlete, they want to get back onto the field as soon as possible. One, because they're earning serious sums of money and they don't want to lose on their money earning potential. But the other thing is, if you play a team sport and you're out for a season and a half, I'm afraid to say the coaches and the selectors forget about you. So there's a lot of pressure to get it reconstructed immediately. But to my view, and most other surgeons, this is not ideal. Because if you go ahead and do the reconstruction immediately, you are then going to combat something called arthropibrosis. That means if you operate on a knee that's already angry with injury, the body is going to be trying to heal this injury straight away. And that healing process can lead to scarring and stiffness and make the rehabilitation very difficult and quite prolonged. If you're an elite athlete, you'll go through prolonged discomfort to try to get a good result as soon as possible. But for the normal retail athlete, the normal person, it's much better to wait a few months, wait until all this swelling has settled, wait until the knee's moving properly, and then you go ahead with the reconstruction, classically 3 to 4 months after the initial injury. So in summary, ACL injuries are relatively common, not just in elite athletes, but in the normal person who's out on a holiday and just twists and falls. The best thing to do is to get an early diagnosis so you can have effective physiotherapy, and then you can arrange in a timely fashion for an ACL reconstruction if and when it's necessary.